We're going to hear from Jessie Johnson of Pacific Hearing about a new treatment for tinnitus that can actually be applied at home. Jessie is the manager of special projects at Pacific Hearing, and she's ready to go. So Jessie, take it away.
Thanks, Jim. I am going to share my slides. Hopefully, let me see. There we go. Hopefully everybody can see those.
Yep.
All right, and we're gonna try to wait for questions till the end if we can. So just raise your hand on the screen so we can get to you afterwards, all right? So a little bit about where I'm coming from is Pacific Hearing Service. I've been working here for about 3 years, but previously, some of you might know me from the Hearing and Speech Center of Northern California up in San Francisco. Pacific Hearing Service down here on the peninsula, we have 2 locations, one in Menlo Park and one in Los Altos. And this is our tinnitus team. So we have 3 audiologists on board that specialize in tinnitus. And then I am also helping to manage some of our caseload and work here on the tinnitus team. So I'm going to talk a lot about tinnitus in general today, and then also about the new Lenire treatment. So I love this slide, which is tinnitus or tinnitus. Either way is correct to say, but I like this slide because it says either way it's annoying. And tinnitus is the perception of sound. There's no actual external noise present. It's just a sound that our brain is creating, and it can come across, often people call it ringing in the ear, but it can come across differently for everyone. So it can be a hissing, a whistling, a swooshing, a clicking, and there are even some rare cases where people report hearing music. It can be temporary or it can be chronic. About 25 million Americans experience tinnitus. It's a really large number of people. Majority of people, about 80%, find that it's not that bothersome for them. But then there's another 20% of people out there that find it more bothersome, and that's usually the people that are looking for support. A lot of people can just go about their day with tinnitus and it's not as bothersome, so they're not always asking for help. 99% of tinnitus is subjective, meaning it's a sound you hear. There is a small percentage out there of objective tinnitus where someone else can hear the sound. And that's usually coming from a different health condition that can be addressed. But for everybody else, that 99%, we're looking for ways to make it more manageable. Some more statistics on like who gets tinnitus. It's a little more common in men. So 12.8% versus women, which is 9.7%. And then with age, sometimes we see an increase. So kind of starting around the age of 40 and then peaking into our 65 to 80-ish year olds. And then after 80, that kind of starts to decline. So 40 to 80, you're kind of looking at most common range of ages for people with tinnitus. Some kind of consistent questions or comments that I hear from our patients. It's like, what's the cause? Is it going to go away? This one is my least favorite thing to hear from people when they reach out is, my other provider told me there's nothing you can do and just get used to it. Should I be concerned? And why is it so bothersome? So I'm going to kind of get into some of these questions. There's a lot of common causes for tinnitus. So one of the main causes that we see is often hearing loss. So if there's any type of hearing loss, that can be like the brain is just missing some information, it starts to fill in the gap, and it creates this tinnitus sound. So hearing loss is a really common cause of tinnitus, but there can be other things. Noise trauma is high up there. Any type of congestion or cold sometimes can trigger that for people, because again, it's a type of hearing loss where when our ears are feeling plugged up. Accidents, traumatic brain injury, whiplash, COVID. There are some studies out there now about COVID causing hearing loss, right? So then COVID related tinnitus as well. So there's some studies that are being done about that. TMJ, or really any kind of like chronic neck pain, can also be a cause. Stroke, certain types of medication, diabetes, surgery, anywhere, especially around the ear and neck, surgery can cause tinnitus. And then stress and anxiety are big components of our tinnitus causes. There's ear conditions as well. So sometimes just earwax being in the ear or having an inflammation in there can cause the tinnitus. And then other kind of more serious ear-related conditions like Meniere's, otosclerosis, or acoustic neuromas are also causes. So what's the big question usually? Is it going to go away? And my doctor or my other provider said there's no cure. So there's so many causes, we don't always know if it's going to go away. When there's a specific reason, like wax on the eardrum or an ear infection or a medical condition, sometimes like just surgery or starting a new medication, sometimes when our body starts to heal from that process, or like removing the wax or the ear infection, the tinnitus, it could go away. Sometimes our brain gets kind of triggered and tuned into it. So even though it gets lessened, we're still kind of aware of it, but it usually isn't as bothersome for most people after that kind of initial impact. And then the body starts to heal. We don't notice it as much. For those other people where it's more bothersome, then we're looking at effective ways to manage the impact that we have. So for this 80% of people who have the more or less bothersome tinnitus, it's kind of easier treatment methods. And I'm going to share a bunch of those today on helping to manage it and get the body, like Mother Nature, right? It helps us to adapt, and finding some tools and techniques to do those adaptations helps manage the tinnitus. So we're in that kind of non-bothersome category, which is where we all want to be. I also have tinnitus myself, and I'm kind of in that non-bothersome category and have been. I've had tinnitus my whole life, like since I was a child. I don't know where mine came from, but I'm in that non-bothersome category, I would say almost my entire life. But I've had some instances where I've been shifted over to the other 20% of the more bothersome category. But most of the time, our nervous system starts to realize that we don't have to be in fight or flight mode with the tinnitus, and we start to adapt. So we're not in that having those sensations. For the people that are, hey, my tinnitus is really bothersome, that 20% of people, it can affect our daily life. It can really impact our sleep. And when we have poor sleep hygiene, we kind of get into this cycle where the tinnitus, I didn't sleep well, my tinnitus is worse the next day. And then other things that it commingles with that we know can be triggers, like anxiety, high attention to detail, and high stress. And when I mean high attention to detail, kind of those people that are in the category of having OCD, it can commingle with the tinnitus as well. So for those folks, their nervous system feels like it's under threat all the time. And so finding ways to cope is harder. And sometimes people are in these areas of stress where they don't even recognize stress, right? Like, oh, I'm going through a divorce, or I'm quitting my job, but I'm fine. but really our body is not fine, right? That stress is there and it can trigger the tinnitus. So having to deal with some of the emotions around our stress is an important part sometimes of dealing with our tinnitus as well. What we hear from most of our patients that are coming in for treatment is by the time they've had a consultation with one of the audiologists that specifically specializes in tinnitus and they work with them, they feel like they understand what's happening in their body. Things make more sense and the tinnitus becomes more manageable, sometimes pretty quickly for people, like within the first week. And then other times we're looking at more treatment options, which can take longer. So I'd say the majority of treatment when we're talking about treatments is about a 12-week where we're really focusing on the tinnitus. One really great option for tinnitus treatment is that's been around. We've had a lot of treatments that have been around before Lenire for a while. So one of them is cognitive behavioral therapy, or CBT. There's some great programs that are out there right now. We have a wonderful psychologist locally. Her name is Dr. Jennifer Gans. She works with patients in private practice and she helps deal with struggles. She works with both hearing and deaf populations. She's fluent in sign language. She works with anxiety disorders, depression, stress management, sleep difficulty, particularly related to navigating the challenges of tinnitus and hyperacusis and hearing loss. So she is great. She's in San Francisco. You can reach out to her. If you Google Dr. Jennifer Gans, you will find her website. You can contact her directly. She also has a program that she created called mindfulness-based tinnitus stress reduction. So it's a cognitive behavioral therapy program. That's about an 8-week program that you can do. It's a self-paced program. So you can sign up for everything through her website and you can do it in your own time. There's some other great CBT-based programs for tinnitus as well. There's a new one called OTO, O-T-O, and that's an app-based program. Again, about a 12-week program. And if you look them up, if you find their app, you can do the first couple of the sessions as a demo or a trial. So you can always look into that if you're interested in checking them out. And of course, stress management is a big component of that. So there's Judith Moskowitz is a PhD, and she's studied how positive emotion skills can help us cope with stress. So she has this really great 8 skills to manage stress, these stress busters. So if you look at them over, and I can share these with Janie so she can send them out to the attendees, but they're just really good things about trying to notice the positive events. I think sometimes when the tinnitus is bothersome, we kind of get into that state of helplessness and depression. So sometimes having to look on the other side of the coin for positive events and practicing gratitude, being mindful about your body, things like that can be very helpful to try to help manage the tinnitus and when it's bothering us. One of my favorite treatment options is sound therapy. So sound therapy and hearing aids kind of get tied together sometimes. Hearing aids because we're giving the brain back the information that it might be missing. So it's not working so hard and creating that sound. We're naturally just kind of providing amplification back so the brain is not all stressed out about missing information. Simultaneously, a lot of hearing aids have built-in sound therapy or sound generators that the audiologist can set up as a special program to use during the day while you're wearing your hearing aids so that you can switch into sound therapy. If you don't wear hearing aids or have hearing loss, we even have some patients who don't really have hearing loss or a very mild hearing loss that will wear hearing aids for tinnitus treatment, but also to use the sound therapy. If you don't wear hearing aids, you can do sound therapy, or like for me at night, I use sound therapy. So what it is just having another sound where there's contrast between quiet and then also a tinnitus. and it can make our tinnitus feel smaller. It's like a distraction for your brain. It doesn't have to be a sound that's louder than your tinnitus. It's just something that your brain finds more interesting, so it can focus on that. So for some people, that can be like just having the fan on or putting the TV on to fall asleep at night. And for others of us, we can dig in a little bit more using different types of sound. There's a lot of great apps, and I didn't put it on my slide, but my favorite app for tinnitus that's free is the Resound Tinnitus Relief app. And the reason I love this app is because, and I'll type it in the chat here, I love it because you can make up all your own sounds. So there's like 5 different options. You can pick and choose a lot of water related sounds because those can be often very relaxing and soothing. For me, I can't have just like one constant sound because then I feel like almost like my tinnitus catches it, right? Like I have my tinnitus as a constant sound and now I have this other. So I like to have some flow, almost like some music or something that goes with the water. So I have a little bit of contrast in there. But everyone will find different sounds that can be helpful for them. But sound therapy is a great treatment for tinnitus. And for people who have their tinnitus that's bothersome all night, when we talk about hearing aids, the Lyric is an option that some people will wear if they have a mild hearing loss. The Lyric is that type of hearing aid that stays in the ear canal. It's a subscription-based hearing aid, and you wear it 24/7 until you come in to have it changed out about every 6 to 8 weeks. So now I'm going to move into Lenire. Now that I've got all the other kind of overview of some of the other treatments. So Lenire is treating using bimodal neuromodulation. So there's 2 stimulus coming into the body, one through the auditory system, and then one with the electrical stimulation through the tongue. So there's 2 stimulations coming to the brain. So it's sending this kind of electrical signal to the brain at the same time as the sound is coming in through the ears. And then that is helping the brain change its neuroplasticity about what it's doing with that sound information. So there's kind of this like hyperactivity that's happening in the brain, and we're activating the auditory pathway and then the non-auditory pathway. So through the ears and then through the tongue. And that helps to reduce that hyperactivity that's happening in the brain. It's kind of similar to the treatments that they've been doing research on for people who have like phantom limb pain. So someone who's lost a limb, but they still feel pain there, right? The brain is like making pain in a place where we don't have that body part. And so it's doing similar treatment using sometimes like VR glasses and then electrical stimulation to like retrain the brain about that pain management. So it's very similar where they got the idea from for this Lenire device, which is the bimodal neuromodulation. What it looks like, well, and let me back up one second. So it was FDA approved in the US in March of 2023. Pacific Hearing Service, we went through our training. We were one of the first 50 clinics in the United States to offer Lenire, and they've been slowly rolling it out because you have to go through training with the company in order to be a provider. So that's why it's not offered everywhere, because you do have to pass through the training. The device itself consists of 3 components. So it has the controller, which is in the middle. So that's like it's almost like a little iPod kind of a thing that just has a couple buttons on it so you can turn it on and press play or pause. And then there's some volume control for the headphones and kind of a stimulation control for the tongue tip. And then you've got the tongue tip. So that goes right, just like it says, on the tip of the tongue. And there's about 20 little electrical stimulators on there. It's very light stimulation. Most people say it's a sensation of drinking bubbly water. So it's not painful at all. And the tongue, so that tongue tip sits on the tip of the tongue, and you just close your lips around it and hold it in place. And it's wired into the controller. And then you have the headphones, which are Bluetooth connected to the controller. The headphones are providing just like a type of sound therapy, and they're kind of synchronized. So the headphones, the sound that's coming out has kind of a synchronization to the stimulation that's coming through the tongue tip. So I have a little video here that I'm going to play from Lenire. Hopefully it will play. Lenire. Can everyone hear it? Okay.
There's no sound, Jessie.
Are you not hearing the sound?
No.
No.
No
Okay.
sound.
I can skip this video. It's essentially telling you. Let's see. Did it go this time?
No sound.
So it's essentially telling you when we use sound therapy, it's kind of the brain, it kind of reacts to the sound, but then the brain gets used to it. Is anybody else hearing me like twice? Okay, I was just having a weird audio thing. With the electrical stimulation, it helps to rewire the brain. So they kind of talk about in the video, they talk about like if you're somebody who learns how to play the piano, right? You have the auditory input, the visual input, and then your fingers are working the keyboards. And when you first start doing that, it's hard work. But then after you've practiced and practiced and practiced, it becomes easier. And that's kind of what the video is explaining about the neuromodulation is the rewiring of the brain, right? With the practice. So, and having the different auditory stimulation, the visual stimulation, playing the piano, it's a similar thing when we're doing the treatment for Lenire. Lenire itself it has a few contraindications, so it's not recommended for everybody. So there's a few things that we have to look at. So if you have, like I have up on the screen, if you have a pacemaker, defibrillator, or any other active implantable device, because you're using electrical stimulation, it's not recommended unless you've gotten clearance by your physician to do it. Same thing if you're pregnant, if you suffer from epilepsy or other conditions that may result in the loss of consciousness, if you have any kind of impaired sensitivity on your tongue or like anything going on in your mouth with inflammation or sores or lesions, then you wouldn't be able to use it. There's other things going on, like if you're suffering from intermittent or chronic neuralgia, so nerve pain in the head or neck area, again, medical clearance from the doctor. It is not recommended to treat Meniere's disease, but I'm on a Facebook group with other Lenire providers, and we have seen that there has been people who've been treated with Meniere's with a Lenire device and have had successful treatment. And I'm going to talk about the outcomes, which have been similar. So I think we're learning, right? Because it's newer in the US. We've only had it since 2023. So we're still learning on some of the treatment. And then of course, if you have objective source tinnitus, so that's when someone else can hear it. Or if you have any piercings in your mouth, right? Because we're having that, you have electrical stimulation to the tongue, so you can't have anything metal in your mouth that's going to make contact with the tongue tip stimulator. And this is what the treatment plan looks like. So really, when we're talking about any type of tinnitus treatment, the first step in the process is to have a hearing test. We need to find out what's happening with the hearing to see if that's playing or has a role or impacting what's happening with the tinnitus. So a hearing test that is less than a year old. And then the next step would be a tinnitus assessment or a tinnitus consultation working with one of the audiologists that specializes in tinnitus, and then again has gone through the Lenire provider training so that they can offer Lenire. Once you've gotten that recommendation from the audiologist, we fit the Lenire device. The Lenire fitting takes about an hour to get through getting it set up, teaching you how to use it. And then once you have the device, it's a medical device that you purchase and you own. And it comes with the treatment plan where you're working with the audiologist. The treatment is for about 12 weeks. That's the minimum treatment time. And you're doing your treatment at home so it's 2 sessions a day. There are 2 30-minute sessions, and that's for a minimum of 12 weeks. So it is a time commitment. So you're doing those sessions on your own, but then you have follow-up visits with the audiologist. So it's typically at about the 6-week mark, and then again at the 12-week mark. And during that first 6 weeks, in our office, I do a couple of points of contact by phone with you to make sure everything's going okay. One of the things that the most successful patients that are doing their Lenire, what we're seeing for successful outcomes is that we really have committed to the 30-minute sessions twice a day. That's consistent. And during those sessions, they consider it, you have to be me time. So you cannot be on a screen. You cannot be exercising where you're like elevating your heart rate at all. So it's really trying to find something where you're like maybe reading a book or doing Sudoku or word searches, things where you can kind of be in your own space, not having interaction with anybody else. That's why not having a screen or having a phone is important, right? Because we don't want somebody to like suck us into their time. This is your time during the treatment. And so that is sometimes challenging for people who are still working, right? Trying to find that time. So another thing that we consider during that candidacy process to see if it's going to work for you, because if you can't commit to that hour a day, we're not going to see successful outcome. What the outcomes are looking like. So this is a slide from Alaska Hearing and Tinnitus Center. This is Dr. Emily McMahon, she was the first Lenire provider in the US, and she still travels to lots of the parts of the country, including the Bay Area still, to provide services. So she has seen probably more Lenire patients and done more Lenire fittings than anybody in the country. And so she put this information together after about, I think it's about 14 months of treatment where she saw 214 patients, which was probably almost more patients than they saw during the research that they did over in the UK. And this is more like real world. So the research behind Lenire showed us that about 80% of people that went through treatment had a positive outcome, which meant that they had a change in their tinnitus score. There's a questionnaire that everyone takes, and there was a change in that score by a certain amount that showed that they had a positive outcome. And so that was 80% of patients during the research. That's how they got the FDA approval. So now in the US, what we're seeing in our office, very similar to the results that Dr. McMahon got here, is somewhere between 70 to 90% of patients. So she's saying out of her 214 patients, some of them were hearing aid users and some of them weren't. The hearing aid users got a higher benefit, 92%. And then the non-hearing aid users about 86%. And I would say we're seeing kind of a similar outcome. Sometimes people have hearing loss and they're not treating the hearing loss. They say, oh, my hearing is not that bad. That's not what's bothering me. The tinnitus is bothering me. But if the hearing loss is impacting the tinnitus and we're not treating it, we're going to see the tinnitus still kind of showing up and showing through. So that's why it's important. These conversations with the audiologist that specializes in tinnitus is important, because we want to make sure we've got an individualized plan for us for having good outcomes, whatever the treatment option is, but particularly around the Lenire treatment. I'm going to move on to another treatment that's similar that's being studied right now. So out of the University of Michigan, Dr. Susan Shore is also working on a device that's similar right? You can see a picture of it on here on the screen. So there's electrodes that she uses on the cheek and neck, and then an earbud. So similar bimodal neuromodulation that she's working on. So they're still in the research and they have not received the FDA approval yet. And it is supposed to be for treatment of somatic tinnitus. So somatic tinnitus is when you have a change or a shift with your tinnitus when you are moving your head and neck around, right? If you can positionally change your head and that changes your tinnitus, that's somatic tinnitus. So then we're looking at this as a treatment option, but it's not available yet. It's still in the research. And then there's other treatments that are out there that we sometimes make referrals to other providers that can be helpful depending on where we might think that cause, like going back to the cause of the tinnitus. So if we're having like TMJ or any kind of head neck trauma, working with like a physical therapist, a chiropractor, cranial sacral therapy, acupuncture, all those things can be helpful in the treatment of the cause. And then there are some supplements that are out there. So supplements are kind of tricky because it's oftentimes if our body is lacking some of the necessary supplements like vitamin B or zinc, then providing the supplement to the body helps create a type of healing that can help with the tinnitus. There has been a study about ginkgo biloba right now. You can find that on the American Tinnitus Association website about treating tinnitus with ginkgo biloba, and they're having some successful outcomes. And then the melatonin is really there for treatment of sleep issues to help the sleep cycle. And then other things that we know that can affect our tinnitus can be like diet. So some people have triggers like chocolate, caffeine, alcohol, or salt, noise exposure, and again, back to the stress and anxiety and sleep. Those are all kind of triggers for our tinnitus. So oftentimes, if you know that's a challenge for your body, then trying to eliminate some of those things to help treat the tinnitus. The internet can be great for finding information. Like I've had so many people reach out to me about Lenire because they found it online, but it also can be really challenging because there's a lot of misinformation on the internet as well. So it's really important to look at who published the information. Is there research behind it? What sources do they cite? Is there conflict of interest? Are they trying to sell you something? How up to date is it? Is it just an exaggeration? So you're looking for sources like these. The American Tinnitus Association is a really great source, the American Academy of Audiology. And then anything, if you're doing search engine looking for information like Google Scholar, PubMed, +1, PLOS1, and then anything from like the National Institute on Health, university websites, Centers for Disease Control and Prevention, you're going to find hopefully reputable information there, but not like just like some website that's like, I can't remember the name of one, like Noise Silencer or something like that. Is probably not a reputable place. But you could go to the American Tinnitus Association, see if you can find anything about them, and then they'll give you more information. So just be wary about some of the online resources that are out there. Make sure you're looking at, right, anything that's like from a .edu is probably really helpful, or .org usually. There's also tinnitus support groups. Like we have some people joining us from all over the US right now for the HLAA group. That's been what's so great about going online with Zoom, is that there's some really good support groups that are still meeting online. So again, the American Tinnitus Association, you can find the support groups that are meeting online. So you can check out who is available to you, what time works for you. But we also have a local group in Palo Alto that meets, and I have their information up on the screen. You can email to the person who runs the support group is Ken Adler, and his contact information is listed there. But they meet in online and then also in person. So you can go either online or join them in person. And it's the third Thursday of the month at the Avenida Senior Center in Palo Alto. So what are your next steps if you're trying to find out, is Lenire going to work for you? Is another treatment option going to work? You're going to maybe, if your tinnitus is not that bothersome, maybe explore some of the resources I talked about today, or maybe you're ready to take the next step. Then the first thing, as I mentioned, is to get a hearing test. If you haven't had a hearing test in the past year, no matter where you go for services, whether it's our office or to another provider that specializes in tinnitus, they're going to want a recent hearing examination. So get your hearing test done and then set up the tinnitus consultation or a hearing aid consultation if that's going to be the next step. But the tinnitus consultation. And if you've already gone through these steps and you're still looking for support, then follow up with your audiologist. They're going to give you the best information. I'm going to quit showing my slides so we can get to some questions. I know I kind of went through a lot of this, but I figured the question and answer portion is probably going to be the most helpful for everybody. So it looks like there's a question in the chat. I'm going to start with that one first. How do you measure benefit with Lenire? A percentage improvement? If so, what was the threshold? That's a great question, Laurel. So there are questionnaires that we have you fill out when you come in for a tinnitus consultation. And it's one of the same questionnaires that they used for the research for Lenire. And one of them is called the Tinnitus Handicap Index, or the THI. So it's 25 questions. They're subjective questions about how bothersome your tinnitus is. And there's a scoring system. So if you say no, it's 0 points. If you say maybe or sometimes, it's 2 points. If you say yes, it's 4 points. So 25 questions, that's a total of 100 points. So typically when we're looking at treatment for Lenire, the candidacy is like kind of in the middle range and higher. So 38 points or higher. And so when we were looking at the improvement, it was a statistically significant change on that scoring system, which would be 7 points or more. And that's what we're looking for. So it's not really a percentage, but we're looking for a change in that score. The other thing that I have noticed since we've been working with Lenire, so Lenire started in the US in 2023, but they did their research for a few years over in the UK before this. So what we've noticed is not everyone is quote unquote a candidate when it comes to that THI score. So sometimes people are on the lower end and they still want to move ahead with treatment. So it's a little bit harder to gauge a shift in those numbers because they might have started with a really low score or had somebody started as a 2. You can't really get much improvement except for to go to a 0, which is, not really, usually we're not looking for it to cure our tinnitus. We're just looking for it to not bother us as much. So then we're looking more at asking questions about did they feel it was successful and why? Or what was it that changed about their tinnitus that they felt there was improvement? So those are kind of more subjective, but we are seeing about 90% of people saying they have positive outcomes, just even if their score, the number score, didn't change that much. Hopefully that answers your question. And then I am trying to get to the hands up. So right now on my screen, I can see Kenneth Peterson.
Ken Peters. Thank you,
Hi,
Jessie.
Ken.
Excellent presentation. Thank you.
Thank you.
Can you tell a little more about the relationship between hearing loss and tinnitus? For those of us who have hearing loss, one of my biggest fears, I'm going to start developing tinnitus later in life. Does it usually come on early on in your hearing loss? And why do you think some people with hearing loss get it and some people don't?
Great questions. And a lot of those are kind of unknown answers, right? It's different for everybody, but kind of the science behind it, what we know is that when the brain is missing the information, right? And it's not getting the information. And so for a lot of people, that can be these like high frequencies that sometimes we don't even test when we do a normal hearing test. Because usually if you look at your hearing test results, it goes up to about 8,000 hertz. And oftentimes tinnitus is a higher pitch than that. So for a lot of people, it's those really high frequency hearing losses that's where we're hearing our tinnitus. So it doesn't always mean just having hearing loss doesn't mean you're going to have tinnitus, but because the brain is reacting to sometimes missing that information. And it can also be like a combination of things, right? It could be, I have hearing loss and I didn't really have tinnitus, but then something else happened in my life. Maybe like a noise exposure or something going on with your neck pain or a trauma, something like that, then is a trigger that can start it. And then oftentimes, like I was saying, our brain gets kind of tuned in to it and we have a hard time then tuning it back out. So that's why learning these techniques are important. And then there's, like some of the statistical averages where we see like 40 to 80 is where like a lot of people, their tinnitus is more noticeable. Well, that's often where we're seeing shifts in the high frequency of hearing changes and maybe untreated hearing loss. And then after 80, maybe we're treating the hearing loss more commonly, or our body's just adjusted and we don't find it as bothersome.
Do you think there's evidence that using hearing aids early on helps prevent tinnitus?
I don't know if there's evidence about that, but I would say I don't know if there's been studies. So we have like the research behind early intervention, but I would say just knowing, I've been doing this for 25 years and just knowing that even for those people who have like those mild hearing losses, hearing aids can often I actually just had a patient today who has one of those mild hearing losses, and she was demoing hearing aids for a week because she wasn't sure if it was the cost benefit for her, if she was like there yet for her hearing loss. And she said the big shift for her actually was there was a few things about the hearing that was helpful, but it made a huge change in her tinnitus right away. And so she's like, I'm ready to get hearing aids because of it. And we hear that a lot from patients. So I would say that, there's a lot of information that matches up for that.
Thank you.
And I don't know, Janie and Jim, I couldn't see whose hand went up next. I see Scott's hands up. And I saw that, Scott, you had a question in the chat. Did I answer your question in the chat or did you have another question? When the Lenire first started? No, new question. I didn't answer your question. How did Lenire start, or when did it start? The start.
When?
Where? So Lenire. With Lenire or the tinnitus?
Lenire.
Lenire. Okay. So Lenire, they started doing their research. Sorry, my sign language is rusty, Scott. I'm sorry, I'm trying. So the Lenire they started doing the research in the UK. So the company is based out of Ireland originally, and that's where the research was done. And when did it start? I would say I first started hearing about it probably around 2019, 2020. I don't know if it was before then, but I remember in the support group that I was managing during COVID, we talked about it a lot because they were starting to have research and everybody was like, how do I get in on the research? But it was all over in the UK, so nobody could get involved. But so we were waiting for the result and the information. And that was during COVID when we were like starting to meet online. So 2020, 2021, around that time. And then we got the FDA approval from that research that they did. The FDA approval came through to the US in 2023. So it's pretty new still here in the US for treatment. 6 years. Yeah, 6 years now that they've done before the research. Yeah. Good. All right. And then I don't know who is next. I see Mr. Hall. Robert, you had a question?
Yes, I've had Meniere's since I was 21. That was my first vertigo episode, and that was caused, I'm pretty sure, by radium rods that were put down my nose when I was 6 years old to cure my earaches. So I'm just curious about I would think that the whole issue of Meniere's disease is quite complicated, and some people probably could help with this and others maybe not, but I almost I'm not bothered much by my tinnitus at all. Even with my implants out.
Yeah. So you're right. The Meniere's is tricky. So when we first started working with Lenire, they were like, no, not for treatment for people who have Meniere's disease. And I'm sorry if I'm messing it up. Lenire, my brain right now if I say the wrong one, but they had first said no. And then I had somebody reach out to me who had Meniere's, and she had gone through everything, and she was kind of at a point where she had all of her symptoms managed, but just the tinnitus was still bothersome for her. And so that's when I started looking into a Facebook group for the Lenire providers, and there was quite a few people who have treated patients with Meniere's. So it's kind of outside, right? It's like when we're doing outside of their recommendation, but somebody might still want to move ahead. And they've had a lot of people who've been successful, but we all are, any of us who have tinnitus, we're all trying to get down to probably where you and I are, Bob, where I have it, but it doesn't bother me most of the time. I can manage my symptoms. And that's where most people are trying to get. I think Lenire is really for a lot of people who are kind of where they can't manage their symptoms and they need the extra support. That's what we're looking at for treatment. And it doesn't, so I'm going to answer, as we're talking about this, a question that's in the chat about the cost of the treatment. Because, hey, why not try it if it's, maybe it'll help. Just go ahead and try it, right? You might be in that boat, Bob, where you're like, hey, my tinnitus isn't that bothersome, but if it'll help me, maybe have a good outcome. Why not? Why not is because the cost is $4,700 for treatment. So you're buying the device and it comes with a treatment plan. In our office, that's the cost. And it's similar probably most places that you're going. So it's not taken lightly, right? Because not everybody has like $5,000 to just drop to see if it works. And so that's why that candidacy and the conversation to see if we feel like this is the right treatment option for you is important. If your tinnitus is not that bothersome, then maybe we can manage it with some of the other treatments that are out there. Maybe this isn't the right option for you. But if the tinnitus is really bothersome and you feel you've tried all these other things and we're still at a place where it's bothersome, that's when it would be more likely to move ahead with the treatment.
Thank you.
I hope I got Bob and Judy's question, and then I'm gonna go up. Judy, you have your hand raised, but I don't know if it was to ask me about the cost.
Yes. I've had tinnitus in both of my ears for 50 years. This year I had an acoustic neuroma, which was, I was really suicidal from the tinnitus.
Mm-hmm.
It was not at all, I can't live with this for sure.
Mm-hmm.
So over the years, that was 50 years ago, it is really, it's not as loud, it's not as bothersome, I'm used to it, it's fine. Then I have a multiple of problems in my other ear. So between both ears, I have an orchestra of tinnitus, clicking, I have rushing, I have a train, I have an airplane, and everything is happening all at once. So
I'm
the
sorry.
most disturbing part of it is a clicking that I'm getting. There's just like just a sound, and it's happening in both ears, and that's kind of new. And I'm wondering what that is. But I'm 80 years old. I've had tinnitus for 50 years. So I'm used to it. It doesn't bother me.
Mhm.
I'm more aware of the clicking.
Okay, and that's new. Because so the acoustic neuroma in one ear, but have you had the other ear tested recently?
Yeah.
Okay. No shift in the hearing, or maybe we shouldn't be talking about this
There's
online,
been a
but
shift in hearing.
there was.
Yeah.
Okay, that could be because oftentimes
I had
I've seen.
COVID too.
Okay,
That's when my hearing went down during COVID,
yeah,
and it hasn't come back. But
Uh,
with the clicking, I'm just aware of it, where I'm not aware of the other noises going on. I've gotten used to it.
yeah. Have you ever
Where's the
worked with
clicking coming from?
Have you worked with any of the audiologists that specialize in tinnitus to talk about treatment options before?
I've never, this is the first I've found any information about tinnitus. And I've been seeing an audiologist my entire life.
Yeah,
No
but
one's,
not all of them
are you bothered by
specialize.
tinnitus? Nobody mentioned my tinnitus. It's like I have an orchestra.
Yeah, I think that's one of the big challenges, and I'm thank you for bringing this up, but I think one of the big challenges that I've seen over my longevity of being in audiology, not all audiologists specialize in tinnitus. Ear, nose, and throat doctors are sometimes the worst culprits of the not asking questions, or if you come to them saying, I have tinnitus, it's bothering me, they're not really making a recommendation to go work with somebody who specializes in it. So audiologists go through specialized training, right? It's a specialty for them to get certified in tinnitus treatment. So that's why not all audiologists even address it. And I think part of the thing that I've been like, Lenire is not always recommended for everybody, but one of the great things I think, because of the FDA approval, conversations are happening. People are calling to ask, can I get this treatment? And even though it might not be for everybody, at least information is getting spread about other types of treatment that are out there. So I think it would be really great for you to maybe start working with somebody that can help you, especially if it's bothersome, right? Some of us, like I'm in the category of mine not been, like Bob was saying, mine's not really bothersome. I'm aware of it, but it doesn't bother me. Now, I've had times in my life where it's changed, like you have different tones or things that were affecting it that increased it. And then it's kind of scary when that happens, because especially when you've had it for a long time, like you and I, you're like, what is this now? What's happening now? Right? I noticed last year for me, over the holidays, that now when I drink alcohol, my tinnitus for me in the morning isn't even noticeable. But if I drink alcohol, the next day I wake up with my tinnitus. So that's like a new shift for me that happened last year. And those kind of things can be scary when that happens, because you're like, what's going on? I thought I had it under control. I thought we were cool, tinnitus. And then something changes, like with your clicking, that you're like, what's going on now? So then it's good to talk to somebody to see if there's anything that we can do for treatment to help it bring it back down to that more manageable level.
Medicare pay for any of that?
Medicare usually doesn't cover any tinnitus related, like consultation or treatment, unfortunately. So you're usually paying out of pocket for those services.
Okay.
Okay.
Thank you.
Yeah.
Your information was very well presented. Thank you very much for it.
Thank you. I think Larry is up next with the question.
Yes, I wondered if there's any connection, any correlation between tinnitus and BPPV.
Not that I'm aware of. But again, anytime we have like things that are ear related, right? So ear infection, BPPV is ear related, right? So I don't know if there's studies about it, but I can see that it could be definitely a trigger, just like how Meniere's, right? A Meniere's, do you know what Meniere's is, Larry? So
Yes,
oftentimes,
I don't have Meniere's nose, but I do have BPPV.
yeah, but like Meniere's is that kind of where we get the dizziness and so everything, right, is like that's in the ear. So I can imagine if you have a BPPV, like ongoing issues with BPPV, that there could be tinnitus that could trigger tinnitus. Because anytime it's affecting our ear, our balance and things like that, it can make changes in the ear, hearing, tinnitus, things like that can change. But I haven't read any studies now. I'm not an audiologist, so maybe one of my audiologists would jump in today and say, yes, there is, but I'm not sure. But I can tell you, if you go to the American Tinnitus Association, if ata.org, you could probably look up and see if there's any research about it there.
Okay, thank you.
Uh-huh. I think I got to everybody's questions. Looks like. Hopefully. Oh, Harry.
Sorry, we jumped in. I left actually for a while to check out another Zoom, but it was too research based, so I came back. This is more interesting to listen in on. So thank you. Jessie, I'm from Lincoln, Nebraska, so I appreciate the opportunity to eavesdrop in on your presentation. And so how could one easily determine, and I apologize if this was asked while I was not in on the Zoom, but find a local audiologist that maybe also uses this process?
So for Lenire in particular, their website you can put in your zip code and it'll tell you who's the closest provider. They are slowly rolling out providers. So we were one of the first 50 back in March of 2024. So they have been bringing on more providers. If you don't have somebody locally who works with Lenire, I'll give you a workaround for this in a second, but you could find somebody who maybe just specializes in tinnitus. And again, that's going to be the American Tinnitus Association. You can go to their website to find a provider, and anybody who works with tinnitus usually has themselves listed. So again, you can put your zip code in and see if there's an audiologist close by that just specializes in tinnitus. With Lenire, for everybody that's still on. So what we've seen and why I was telling you about that audiologist from Alaska. She did she's seen the most patients, and she comes to the Bay Area. So sometimes they'll have a provider like Dr. Emily McMahon who might come to somewhere local. So you might see her like that listed on the Lenire website, and you'll be like, why does it say Alaska Hearing and Tinnitus? Because she'll come down like every 6 weeks and she'll see people in person for like the consultation. And then she'll do those follow-up visits, usually via telehealth. So the check-ins and everything can be done via telehealth. And then if she needs to see you in person again, like I said, she comes down every 6 weeks, so she could see you if she has a concern. So there might be somebody like Dr. McMahon who comes there occasionally somewhere close by. It might not be right in Lincoln, although Lincoln's pretty big for Nebraska, right? That's one of your main big cities.
Yes, second, 300,000 is all, nothing like what you guys have, but.
But so there might be somebody like who's working like that. It might not be Dr. McMahon, but somebody else who partners with a clinic in Lincoln that comes like occasionally and then does the telehealth visits. So, and that's worked really well. Like I've had patients who come from 5 hours. When we first started, like people who were like 5 hours away, kind of, we're like in Northern California, and then there's providers in Southern California, but everybody who's kind of like on the what do you call it? The grapevine, like over there, all the Fresno, everything kind of down, like that's a 3-hour drive for some people. So they're not going to come back up for like a half an hour visit at 6 week mark. So we usually do that those appointments via telehealth unless there's like a concern or an update on the device that we want them to come in for. And then we make plans for that. But a lot of patients have done their follow-ups via telehealth.
Great, thank you. I'll check out their website.
Great. They also have that video. I think if that video that wouldn't play the sound, that is on their website too, if anybody wants to check it out. It's just like 2 minutes long, but I like it. It's on our website too. If you go to our Pacific Hearing Service website, and you'll see there's a section on Lenire, and that video is there if anybody wants to watch it. All right, Janie's about to cut me off because it's 2:31.
Let's see, yes. Okay, well, thank you very much, Jessie, for talking to us about tinnitus. It was certainly very informative and educational.
Thank you. And anybody who wants to reach out, if there's other questions that you didn't want to talk about in front of everybody, you can always reach out to me if you want to find out more about our program, Lenire, or just even I'm happy to share my personal experience with my tinnitus too. Sometimes that's helpful and kind of just connecting with somebody. So you can reach me at Pacific Hearing Service anytime.
Okay, I had someone ask for your email. Is it okay if I forward the email to that person who asked?
Sure.
Hearing email? Okay.
Yeah.
I'll do that.
All right.
Okay, thank you so much, Jessie.
Thank you. Bye, everybody.
Bye. Oop, Jim, you're muted.
I saw a question, where will the video of this presentation be posted? And you're the most current person on that, Janie.
It will be posted on the Hearing Loss Association of California YouTube. You know, you go to HLAA California and they have a YouTube in there. And then I think it takes a couple of weeks though.
Yeah.
So it will be posted, it's just a matter of when.
And I just add that is a great resource that the state has. I've gone and seen some of the old presentations that we've had, but also presentations that others have had that are posted there. And it's really interesting and helpful. Okay.